Monkeypox confirmed in Jamaica. Hi again and welcome. This is Links 007 TV News Report, and we'll be right back with the full details to come.
Welcome to Links 007 TV News Report, providing you with the best in local and international news updates. This is a place where you can get the most reliable and informative news information. Links 007 TV News Report.
Welcome back and thanks for joining us. This is Links 007 TV News Report. The Ministry of Health and Wellness has confirmed the presence of the monkeypox virus in Jamaica. The individual who was tested positive locally is a male who recently traveled from the United Kingdom. He presented to the public health facility on July the 5th and is now isolated and his close contacts quarantined after contact tracing was done. This information was disclosed by the Minister of Health and Wellness, Dr. Christopher Tufton, at an emergency press briefing on Wednesday.
Jamaica has its first confirmed case of monkeypox. The patient is a male who recently traveled from the United Kingdom. He presented to the public health system on July 5th, having arrived on the island some 5 days earlier. The patient has been isolated, having confirmatory tests done, and his close contacts quarantined following contact tracing, which will continue if necessary. The confirmation of this first case has triggered our emergency protocols in line with international health regulations protocols. Among other things, our Emergency Operations Center has been activated. A review of all isolation facilities is to be done to look at the capacity to manage both monkeypox and COVID-19. The necessary health protocols, including surveillance, clinical management, lab management, as well as infection prevention and control, are being completed for the distribution to health teams island-wide, and sensitization of the health team and members of the public, which began more than a month ago, is being enhanced. Monkeypox is a viral disease caused by the monkeypox virus, MPXV. The first human case was confirmed in a child in the equatorial region of the Democratic Republic of Congo in 1970. Since then, sporadic cases have been reported from the rainforest areas of Central and West Africa, while large outbreaks have occurred mainly in the Democratic Republic of Congo, where the disease is currently considered endemic. The United States has had a number of imported cases. This year, in addition to the United States, the World Health Organization has reported cases in Australia, Belgium, Canada, France, Germany, Italy, the Netherlands, Portugal, Spain, Sweden, and the United Kingdom. The spread of monkeypox may occur when a person comes into close contact with an infected animal, rodents. Person-to-person spread is generally uncommon, but can occur through direct contact with monkeypox skin lesions or scabs, contact with clothing or linen, such as bedding or towels used by an infected person, coughing or sneezing of an individual with a monkeypox rash. The virus enters the body through broken skin, even if not visible. The respiratory tract or the mucous membranes, that's eyes, nose, or mouth. The incubation period, as we understand it, is between 5 and 21 days. Symptoms are usually mild to moderate and include fever, intense headache, lymphopathy, or the swelling of the lymph node, back pain, muscle ache, or general lack of energy, or a rash. We certainly advise and encourage Jamaicans who may be experiencing any of these symptoms to see their medical practitioner for examination and advice. The CMO is available to provide greater details on the clinical presentation of the virus. Are you going to do that now, or should I complete? Okay, so just to say that there is no present recommendation for the vaccination of the general public. If you are experiencing fever, intense headache, muscle aches, or rash on the skin, you must isolate immediately. Call ahead to your health center or doctor before visiting. All members of the public should wear a mask, ideally where you feel exposed, normally in public. Frequently wash hands and practice physical distancing. So the protocols are pretty similar to the COVID-19 virus. In addition, information on monkeypox, members of the public can visit the ministry's website at www.moh.gov.jm. So that's www.moh.gov.jm, or you can contact your local public health department. Of course, if you visit sites such as the Pan American Health Organization or the World Health Organization, you can get additional information on this particular disease. I want to close before I ask the CMO to comment or open the floor for questions to say to Jamaicans, this is not a reason to panic. It's not a reason to be uncertain or scared. We are informing you as soon as we got confirmation so that you are aware. And I think we have a duty to make you aware. But this information is not intended to cause anyone to be unduly alarmed, except that personal responsibility requires that you protect yourself and that you are observant sufficiently to understand if you think you are threatened either by a third person or you feel threatened personally based on symptoms that you have. It is business as usual in terms of the functioning of the economy. The Honorable Prime Minister and I spoke, and he is ready, always able, as you know, to provide the leadership and the guidance that is necessary. The Cabinet has been informed. And again, the need for the swiftness of the information is out of a duty to inform the public, but not to raise any undue alarm. We will continue the public health infrastructure, our nurses, our doctors, working with other stakeholders if necessary to monitor, to provide information. We did start 4 weeks ago to provide information when the monkeypox alarm was raised in the global community. We had intensified that somewhat based on information coming out of the WHO, and you will see more information going out in the days and weeks to come to keep the public informed as to the status of the disease beyond the one case that we now have, if necessary. But more importantly, to provide information so Jamaicans understand what their own role and responsibilities are. So I will stop here and open the floor, or if CMO, you want to add anything to what I've said, I'll allow the CMO to add any additional information. Thank you.
Yes. Thank you, Minister. I think I don't want to repeat anything the Minister has said, but I just want to stress that the monkeypox disease is in fact a mild disease for what we are used to and what we have been seeing so far across the world. The WHO report at the end of June had in fact recorded about 3,500 cases, and there was only one fatality of these cases. So it is fairly mild disease. However, the public needs to be aware of the risk of getting the disease, and so therefore to take the necessary precautions. This press conference is about increasing awareness so that, for example, travelers that are coming in, persons would, if they would develop any kind of symptoms, any kind of rash, then you should seek help you should stay home for the first part, isolate yourself, and you should inform your medical practitioner that you're coming to visit so that the necessary precautions can be taken. And protect yourself, of course, when you go out from the risk of, protect others, I should say, from the risk of getting the disease by covering any kind of rash that you have. And of course, wearing a mask. The fact is that if you are carrying out the COVID precautions in terms of wearing the mask, keeping your physical distancing, then you will prevent the spread of monkeypox as well. So I would just say also that over the next couple of days, couple of weeks, we will be ramping up our communication campaign in our health facilities, in the media, and of course increasing the awareness of our clinical healthcare workers in order for them to be able to provide help to our clients. So we will be having increased awareness sessions for our healthcare providers as well. So all of this information, I'm asking the public to be recipient to the information, educate yourselves so that you can protect yourself from getting monkeypox.
The monkeypox is a viral zoonotic disease that spread primarily through animals. While a person-to-person spread is uncommon, it may occur through direct contact with an infected individual. Infection typically results in a number of symptoms including fever, back pain, muscle pain, and the formation of skin rashes. More than 3,400 confirmed monkeypox cases and one death were reported to the World Health Organization as of late June, with a majority of them from Europe, the health agency said in an update on June 27. The World Health Organization said since June 17, some 1,310 new cases were reported to the agency, with 8 new countries reporting monkeypox cases. The disease is not yet considered a global health emergency. The World Health Organization have stated that it's deeply concerned about the breakout. Links 007 TV will continue to track this story and provide you with more information to comment this. Thanks for watching.